So one of the biggest questions which students have nowadays is they are good at communication, they speak well, but why are they failing SJ? So what do you think about that, Dr. Ahmed?
Yeah, that's what I was trying to articulate it, and then I think we came to the wording is like they're too scared of showing vulnerability in their communication.
We were discussing that.
Right? Yes. So it's like if there's something they want to come across that everything is perfect and they know everything confidently without any doubt. And I don't know if that's genuine in the way that you'd actually behave with patients. Like sometimes,
basically, genuinity.
Yeah, you don't. It doesn't come across that you're dealing with a live situation. Sometimes there's things you might not know. You might say, "I need to consult someone about this." You might, defer something to be sure of another.
Yeah.
If you're not sure of the diagnosis, you might say, "You know what? Let me wait for a while until we." They're not seeing that you absolutely are 100% confirming something or a diagnosis. What if the diagnosis actually is? The symptoms you have are confusing. Sometimes you have a patient where the symptoms are not textbook.
Yeah.
Do you have to give a textbook answer? Well, no. Maybe I will do some sort of intermediate management and observe it. That's just the reality, right? So it's like being scared of saying that. I think
being scared of being wrong.
I guess so. Being scared of being of showing that you might not know something and you need to wait to know.
Being scared of being vulnerable.
Yes, being scared of being vulnerable, not being able to say, maybe I gotta go, do some more research on this.
Yeah, probably.
I had a patient where, let's say I'm doing my first full mouth rehab, right? I learned some techniques, and I told him this is my first time doing this.
Yeah.
So I told him
exactly. So I think the patient would have appreciated it.
And he was so happy with me. He liked my word. He was like, "Yeah, go ahead for this."
Exactly. So let me ask you a question, Dr. Ahmed. What do you think is the difference between a person who's pursuing dentistry from here or who is born and brought up here and a person who has come as an internationally trained dentist? What do you think is the difference between their communication styles? Do you think there is a difference, or the people who are coming from different countries, what do they need to incorporate in their communication style? What is that one thing?
So
I won't say it is the proper English, but
I didn't work enough in Syria back home to know from experience, but I could kind of know from how I felt about it, right?
Yeah.
So, and how I see people are doing. So I think coming from other countries or, unaccredited countries, I find that the culture there is more like the dentist has to be the all-know-it kind of. There's this pressure where you have to be certain with all your patients almost.
Yeah.
And you can't say you don't know, or people might consider you a bad dentist or something.
Probably incompetent.
Yes. And whereas here, it's very we're very open about a complication. We don't take a complication of a procedure. We don't put that on us as being incompetent. It's just a consequence of the procedure.
That's interesting.
Which the patient got themselves into because they didn't do the preventive work probably. So if the patient didn't do the preventive work and now they need treatment, okay, I could apply treatment, but the way your tooth is going to respond to the therapy and the possibility of me interacting with your tooth, there could be complications. That's not the dentist's fault. I think it's that guilt. There's a guilt feeling with foreign trained dentists, I think, that if they, let's say, break an instrument, it's their fault or something like that. Or if they cause a complication, it's their fault, right? And they feel guilty about it. Whereas here, there's no guilt associated with that. It's more like, this is a complication that could happen with this procedure. We're human. I'm here to apply the procedure. There's complications that could happen with it. It's not my fault. It's not that's just the where the tooth is right now. So it's kind of that.
Okay.
I don't know if I communicated that the way.
Yeah. No.
Did you come across right?
Yes,
you got it. Yeah.
Yeah. So
I think it's there's a big difference in that. One student was like, "Oh, I did an implant. Back home, if I would do an implant to a patient, and I think he said if something fails, I do the implant for free or something like that, or like if this tooth I do a root canal and it fails, I do the implant for free.
Yeah.
Because they have this guilt, like I'm doing the root canal, and I think maybe patients there want that, but here it's not professional to display that you're kind of taking fault if the root canal doesn't work. Like you're doing your best to do the root canal, doesn't work, it failed. That's it. You charge for the implant, and you charge for the extraction. But, it's not like that's.
But I think it starts from the base level here. You start with the proper informed consent. You explain to the patient. You take time. You take out time to explain to the patient, like, okay, I'm doing this procedure. See, this is the complication. This is like benefit of the treatment. If you don't go ahead, like, this would be the consequence. So talking to the patient, explaining beforehand, like taking out that good amount of time, probably that helps.
Maybe that's what it is. Like, is it? Because again, you practiced in India.
Yeah, for 10 years.
So like, was there the step of informed consent, like in India or like in Syria? I'll tell you, like most likely there wasn't.
There is. I won't say there is not, but what I feel is the way of presenting things here in Canada is different.
It's more official when you're stating.
One thing I would say, we have learned to be more empathetic. Like as a dentist, if I'm coming from like a different country and when I'm coming to Canada, being the part of this community as a whole, like a Canadian community, and seeing people around, interacting with people, it has like you have become more empathetic, and that vulnerability factor which we were talking, I think that comes into the communication. So I think that
even
one
communicating the informed consent, I feel like you could communicate it in a way where you already feel like it's a scary thing. Like you're already like that's even something you have to get. I feel like we have to get rid of. So it's like if you're talking to a patient, it's like, look, if we do this, this could happen. This could happen. I'm so sorry. Like it's not your. You don't have to be worried about this could happen. Yes, but this is the best path. Like this is the best option for you now. But there's risks. That is what the reality is, right? And it's not. I shouldn't have to feel guilty or sad about it. It's just the reality, right? I feel like even explaining that to the patient, we're already putting ourselves in a way where like we're scared, like we're already like telling them like, oh, like sorry that this could happen, but no, first of all, one of the mentors I had, I'm only responsible for one set of teeth. That's my teeth. You're responsible for your teeth.
Okay.
So if you got them to the point where they are, I'm here to help you fix them. But if you didn't do the preventive work, if you didn't come in for checks, if you didn't do all that, that's where they are now. But we can help fix them. But there's complications with that.
So the correct information in the correct way.
Yeah. Right. So it's that's a good point. So back to what you were saying about the communication.
Yeah.
We were at like you were saying like delivering the correct information the correct way pretty much is a good way of stating it, and being vulnerable, allowing to be vulnerable when you are vulnerable, showing that is okay.
I think that most of us have to learn. I learned it the hard way. So but I think we need to accept it that
you don't need to be overconfident, in the exam.
We need to accept it that we are humans, we can make mistakes. It's okay to be vulnerable, it's okay to be wrong. So these things, I think people who come from like different countries and they come, so that is, I think, is a Canadian culture, if I would put it that way, that it's okay it's okay to be wrong, accept it. It's okay to be vulnerable. It's okay to show, you are in a dilemma. It's not wrong. Like
an example, like I don't know this. Let me go do some research and get back to you. Can we book a follow-up, for that? This is a complicated tooth. I cannot do it. I would rather refer this to a surgeon. I'm limited in my skill for this.
Accepting it.
Whereas I think in our, like back home, it was more like, being good at everything makes you the better dentist.
You have got the degree, you need to know
everything.
Exactly.
Here it's more like, no, knowing your limit is what's good. That's
the best point.
And I think that comes into ACJ practice a little bit.
Oh, yes.
Because you have to know when not to answer.
Exactly. Yes.
Yeah.
That's good.
Good point. Yeah. Thank you.